Let's talk about abdominal pain with fever. If you have abdominal pain and fever, you have to think about location. If it's right upper quadrant area, you have to think about liver and gallbladder. Let's talk about liver. If you have hepatitis A, hepatitis B, hepatitis C, drug-induced hepatitis, alcohol-induced hepatitis, whatever is the cause, if you have hepatitis and very high elevated liver enzyme, you'll have fever and pain, and sometimes nausea, jaundice, and other symptoms, body ache. So you need to think about these, and so you need to do a blood test right away. If you have a gallstone, or maybe you don't know whether you have a gallstone, but also if you have cholecystitis, inflammation of gallbladder, it causes fever. So you need to go see a doctor and get ultrasound of the gallbladder. If you have a pancreatitis, you will also have fever and abdominal pain, and nausea, sometimes diarrhea. So you need to check pancreatic enzyme on blood test, especially if you're alcoholic, has gallstones problems, you need to check those. Also, you have perforated duodenal ulcer or gastric ulcer or intestine. You have abdominal pain and fever, which is very severe. So most likely you don't have it, but it's a diagnosis, one of the diagnoses. Also, very commonly for young people, appendicitis. Usually start with generalized upper area pain and goes down to localized in the right lower quadrant and has severe pain, tenderness, and fever. Usually young people, but even older people could get that. And if you're an older person, you could get diverticulitis, a pouch. They get infected. And symptoms are very similar to appendicitis. Abdominal pain and fever. And so these, you need to go see a doctor, because if it's diverticulitis and if it's perforated, then it gets a big problem. So you need to go see a doctor and get a proper treatment.